Hey everyone, this is Dr. Jessica Bauer. Happy Wednesday. We're here today for our fertility live Q&A with myself as well as Dr. Duro from Florida Complete Wellness. And I am waiting for her to log on here for us to get started. We have a couple of pre-submitted questions, which is great. We'll get to those, and then we can open up to any other questions that you guys might have that you can certainly put in the feed here. We'll see if she joins. And we will go from there. Let's see, here we go. No, not yet. Hopefully she joins soon. A lot of our questions today have to do with sort of expectations regarding, what to expect after an egg retrieval, and we can certainly get to those and also answer some questions regarding how acupuncture plays a role in egg quality and inflammation, and how acupuncture really supplements fertility treatment, and how it's really important to do all of those things at the same time to really optimize your chances of success. We'll see. Hopefully that worked. Let's see. Here we go.
Hi, how are you?
I'm good. How are you?
I'm good. I was having some technical issues, but I think I'm okay now.
Okay, good. Excellent. We love that. I'm queen of technical issues, so I hear
Yeah. And congratulations. I actually did not know. I had no idea.
I know you only ever see me from the shoulder.
Yeah, and I saw a picture of you the other day. I was like, wait a minute, I didn't know.
Yes, definitely not just a big burrito at this point.
Oh, it's awesome. Well, congrats. Like what, 1 month away, right? Or
a little under.
Wow. Oh my gosh.
So I'll be having a little break from our little sessions
I
here.
figured, yeah.
I will miss, but
I know. Yeah, well, I totally understand.
Yeah.
Oh,
So
awesome.
but all very exciting. All right. So I guess we'll start out by introducing ourselves, and then we can get to some of the pre-submitted questions. So for people that don't know, my name is Dr. Jessica Bauer. I'm a fertility specialist with IVFMD. I work primarily in the Jupiter and the Boca offices. But again, we see patients virtually, we see patients in person, so don't let location, hold you up or stop you from coming to see us. We see patients all over the country, and even international patients virtually. And, we offer a full gamut of, fertility services, including IVF and IUI and fertility preservation. I also myself do a little bit of hormone replacement therapy, or handling women that have things like PCOS who aren't necessarily trying to conceive. So we really offer, a full gamut of services for everyone. So it's nice to be here if you haven't joined us, and if you're a returning customer, nice to see you again.
Yes. That's awesome. I'm really glad that you see, other patients besides fertility patients, because there's so many need, there's such a need for that as far as hormonal imbalances and PCOS and menopausal issues and all that. Like we all have different needs at different stages, so.
Very true. Very true.
And
Yeah.
for those of you who don't know me, my name is Farrar Duro. I'm a licensed acupuncturist. I'm in Hialeah Gardens. We work with patients of really all ages, but mostly in the reproductive span of trying to get pregnant, or patients who are pregnant, patients who are perimenopausal as well. And then we also work with their spouses sometimes too, who need a little support as well. Sometimes that's with fertility issues, sometimes that's pain relief, stress relief, anxiety, all kinds of things that way. So, and I'm really happy to answer your questions tonight regarding acupuncture for those of you who are undergoing IVF or IUI cycles or just trying naturally and have questions. We're here for you.
Perfect. Awesome. Yep. And so let's get started with some of our pre-submitted questions. The first one was, how many embryos would you recommend to freeze before bilateral salpingectomy? I'm 34. So for people that don't know, a bilateral salpingectomy is removal of the fallopian tubes. And certainly once you remove those fallopian tubes, the only way that you would be able to conceive is through the use of IVF or in vitro fertilization. I'm not sure why this 34-year-old is having both of her tubes removed. Sometimes it can be if they're damaged from one reason or another. They might need to come out if they're causing pain or discomfort, anything like that. And I would probably presume that that would be the reason why they were coming out. In terms of how many embryos would you recommend to freeze before that? At the age of 34, I guess I would say, certainly as many as you can, within reason. But I think also the question comes into play, are you genetically testing these embryos? Because sometimes that can give you a little more reassurance. It's really important to understand that even though you're under 35, which is generally the time when egg quality and quantity starts to decline at a rate faster than it did when you were 20, I would say probably at least 30%, maybe even higher, of all embryos that even a 34-year-old is going to make are going to be genetically abnormal. So just because you have an embryo in the bank does not guarantee that that can result in a baby. Along the same lines, even if you have a genetically tested embryo, there is not a guarantee that, that will result in a baby as well. This is not, unfortunately, hopefully, 10, 20 years from now, we'll be saying different things. But even a genetically tested embryo is not 100%, And it also depends on how many, like the size of family that you potentially think that you want and how many children you think you want. If you're genetically testing embryos at the age of 34, which is not necessarily necessary, let me be very clear. I don't know, 5 to 10, something like that. Everyone's a little bit different, everyone's accepting of a certain level of risk that other people won't. Some people really want to peg the bank. Some people say, I'll take my chances with 5 and that's fine. It just really depends. It depends on your choices and your size of family and all those things that I sort of talked about. So
nice. Yeah. That's one of the reasons IVF was invented was for tubal issues. So at least, that's a great option to do, and whenever you are ready, because it sounds like you're not ready to do it yet. So I was wondering if she was talking about freezing eggs or embryos, but it looks like embryos. So those are definitely a good thing to try to, at 34, you should be able to hopefully get plenty, right? Hopefully
theoretically, you never know. Every 34-year-old is created equal, but certainly, having age on your side, meaning, less than 35 is always a good thing. Yeah. So best of luck to you, whatever you decide. And certainly, you should be speaking with whomever you're gonna bank embryos with about your specific case, because really having more information about your egg reserve, about your general health, about any other information about your uterus, your desired family size, can really help narrow that number down a little bit, so that and know what you're looking at, is my recommendation.
Yes, for sure.
Next question is, what is typical for recovery from an egg retrieval? So an egg retrieval, for those who don't know, is a minor surgical procedure that is done under IV sedation. And it's a vaginal approach, so there's no scars on your abdomen. It usually takes anywhere from 10 to 30 minutes. And the recovery is generally pretty mild, I would say. The thing that certainly you have to go home and rest for the rest of the day of the egg retrieval, only because you will have had exposure to anesthesia. So certainly you can't drive for 24 hours and all that kind of stuff. But generally, most people are able to manage any kind of discomfort that they might have, which might be a little bit of bloating, which might be a little bit of cramping, with things like ibuprofen, like over-the-counter Motrin, that sort of thing. I would say that the vast majority of people probably feel better within a day, or even day, maybe 2 or 3 after an egg retrieval. You sort of start to feel more normal. There are certain scenarios in which some people are going to be far more uncomfortable after an egg retrieval compared to others. And that really has to do with more things like hyperstimulation syndrome. Hyperstimulation syndrome is a feature of the stimulatory process that's required for IVF, especially folks that have higher egg reserve or have lots of eggs. That when that translates into a very high estrogen level towards the end of the egg retrieval, or at the time of egg retrieval, and that can result in symptoms of hyperstimulation that often can persist for as long as up to a week after egg retrieval, like bloating and cramping, maybe breast tenderness, maybe some constipation or nausea, that sort of thing. I would say the vast majority of people feel better within a day or 2, and then those that have hyperstimulation are generally feeling much more normal at maximum a week after an egg retrieval.
And she's asking, how long can you expect a period if not transferring an embryo after egg retrieval?
So that usually within a week, 1 to 2 weeks after an egg retrieval. Sometimes it can depend on the kind of trigger shot that you received. Very often, if you've received a Lupron trigger shot, you'll get your period faster than if you've received an HCG trigger shot, something like Novaril or Pregnil. Sometimes that takes a little bit longer for you to get your menstrual cycle. So, but it can be variable. I've seen it before a week, but certainly well within 2 weeks.
Okay. Does it depend on how high your estrogen level is? As far as does that
it can, and also it can also depend on, sometimes we provide patients with a medication that helps bring the estrogen level down faster if it's very high, with an attempt to help them feel better faster. And so sometimes that can speed the process along, because you're going to eventually get a vaginal bleed once the estrogen level dips down low enough.
Okay, that makes sense. A lot of retrieval questions, actually.
No.
Yes. And how long after egg retrieval is the implantation or the transfer?
So that's variable. The vast majority, I would say like 99% of all embryo transfers, probably throughout the country, are done frozen, meaning that usually we like you to take about 1 menstrual cycle off between an egg retrieval and preparing for the embryo transfer. And the reason for that is allowing your body to heal, allowing your hormones to come back to normal, allowing inflammation to go down, and all of that kind of stuff. And most importantly, because there's higher pregnancy rates with frozen embryo transfer compared to fresh embryo transfer. So usually what I tell my patients is that if all goes well, not with the period that they get after the egg retrieval, because that's not really a period, that's more withdrawing from the hormones, but with their natural period after egg retrieval, you can start the process of preparing for the embryo transfer, which in and of itself is about a 4-week process when you're, starting estrogen products to help thicken the lining. And so that's generally what I say. I say from start to finish, like about a 3-month process from starting starting stimulation and getting the embryos and then waiting, 1 cycle to allow your body to recover and then to prepare the uterus to receive the embryo.
Okay. And then there's a Botox question too, like prior to what is that gap time, a month before retrieval or longer, what would you say?
I mean, I'm not sure there's a ton of data. I mean, you have to remember that they tell you not to get Botox when you're pregnant. Mm-hmm. And should we be treating an egg retrieval like pregnancy? Probably in some regards, maybe yes, but I don't think, unless you're getting like an entire face full of Botox, I don't see why getting like a little bit of Botox a month before an egg retrieval would be super negative. I'm not sure we have data I don't have data to back that up. That's just sort of my hunch. Because usually the local
we have the hydrofacials now at our office.
Yes, cool. True. There are certainly other
you can do that when you're pregnant too, which is nice.
Oh yeah. Oh, for sure. Yeah. I'm all about hydrofacial. Yeah. That's good.
Yeah. Next time you're in Hialeah Gardens, you gotta come over.
Yeah, for sure. Let's see. Did we miss any questions?
And there's a few in the chat too that we have get to those too.
An ectopic. Someone was asking about beta levels and can you still have an ectopic with a great beta level? Yeah, the rise that you listed there looks very appropriate. Certainly it is a lot less likely to have an ectopic pregnancy when you have an appropriate rise in the beta, but there's, nothing is 100%, especially if you have a significant risk factor for it or if you've had an ectopic previously. So certainly you're at a level right now, 7,534, where if you're concerned about it, you can certainly have an ultrasound at this point and be able to identify at least a gestational sac within the uterus to provide yourself some reassurance.
Yeah, very good. And congrats, those are great, great levels.
Those are good numbers.
2 embryos frozen. Should I do another round of egg retrieval? Someone's asking. So.
That's like, that's great. Are they genetically normal? How old are you? It's a tough question to answer in isolation. I'm not sure if it doesn't look like it's the same person that submitted the question about embryos frozen. In general, just because I mentioned that, 1 embryo does not equal 1 baby, that sometimes it is wise to, if you are able to and have the means to and whatnot, to perform another egg retrieval to bank more embryos, because if you choose to transfer an embryo now and you do get pregnant, it'll probably be, it's 10 months that you're pregnant and probably a year before you're ready to consider having another child. And that's, for all intents and purposes, 2 years and you're 2 years older. And how well fertility treatments work when you're 2 years older might not be as good. So I think that's something to take into consideration. These kind of questions, after a patient finishes a stimulation cycle, I always sit down with them and say, okay, these are our options, and these are the pros and cons of moving forward with a transfer versus considering banking more embryos. And that's a very important conversation to have with your doctor. Another one, AMH of 1.41 and 9 follicles on each baseline scan. Also need to do PGTA. How many good eggs are realistic for us? So I'm not sure if you mean, and also sometimes people use the term eggs when they actually mean embryos. If you have 9 follicles generally on a baseline scan, and at the time of stim start, you generally can't, you don't expect to get necessarily more eggs than that in a given egg retrieval, right? You would expect to get about 9. You know, say in a perfect world, you were able to get 9 eggs, and then maybe 8 or 7 fertilize appropriately. Then maybe, I don't know, 4 or 5 are make it to the embryo stage where you can do the genetic testing. And then it really depends on your age. Of those 4, how many are going to be genetically normal? It's a tough question to answer without having a little more data, but certainly your doctor should be able to provide you with that information when they, you know, since they'll have all of your specific data, so that you can make sure that you manage your expectations appropriately.
And I was trying to look at the Spanish, the patient or person who typed the question in Spanish, and I'm stuck on one word. So I was trying to look it up quick, but
Hold on.
I don't know if you saw that question.
I want to know if I can get pregnant with in vitro. I think ligada is
wondering, yeah.
Ligada. maybe tubal ligation.
Okay.
I'm not sure.
I got stuck on that word, so I was trying to figure it out. I can't. If anybody else knows, they can type it in. Let's see. Spanish speakers.
Yeah.
That's Shirley. Shirley.
I know, right?
Ligada. Ligada. Tube side, maybe.
Let's see. Oh, and I think somebody answered that they're 40, but I know I need to go back and look at which one that was. I guess the person who's 40, are these 2 genetically normal embryos, or are they untested? Because that's a huge question, because at 40, you're going to have a pretty high chance of unfortunately, genetic abnormalities in embryos. Let's see. I thought, I don't know. I don't know when I type it into, oh no, hold on.
Oh, and you know what? Under the question tab, there's a lot of questions, actually. I don't know if you saw this. If you type in the question, click on that little question mark in the bottom.
Yeah, ligada is tied.
Okay. So
yeah. So yes, in vitro. Yes, in vitro is perfect for someone who has had their tubes tied, because it's in vitro bypasses the fallopian tubes. So people who have had their tubes tied or have damaged tubes or anything like that. So yes, absolutely. Let's see. Okay, so under the question, oh no, hold on.
Well, there are just like 2 acupuncture questions that were pre-submitted, so we'll put those in. And one is to how does it improve, or can it help with egg quality, and can it lower inflammation as far as acupuncture treatments? And there's some research that shows it actually does help. In general, the more, well, let's say between 10 to 12 treatments, and it's dose dependent. So if patients are getting 1 or 2 treatments, maybe it's not going to be that helpful in that aspect. Like, it can help with stress relief, but when it becomes cumulative, as far as, you know, the effects that happen in the body when you do have acupuncture, it can show different effects as far as in general, helping with inflammation and stress relief, blood flow, but also egg quality, because we're looking at even telomeres, you know, lengthening and different things like that. So it's on a different level, but they're doing some interesting studies in China. Maybe we talked about this, but as far as you know, biologically what's happening to cells in the body during this treatment. So it's kind of neat to see that. And electroacupuncture is one of the things that we use when patients have issues with, you know, poor ovarian reserve, or they have difficulties responding to IVF. So that's another tool that, you know, is used a lot in research studies. So that's definitely been shown to help. So And then also we know like a lot of things raise CRP, even like gingivitis and just things that in general are going on in the body. Sometimes we don't know where they're coming from, but we can try to prescribe, in combination with like good nutrition, some rest. We always prescribe sleep. That's like number one. And, obviously trying to regulate your bowel movements, helping, with like getting in fiber, getting in lots of fruits and veggies, all those things, in addition to acupuncture, in addition to like taking a good prenatal, those are a little bit of movement too. It doesn't have to be like knocking yourself out of the gym, but at least some movement, a little bit, 30 minutes a day. Those things I think all help. And in general, when we're going into something like this, IVF, it can be a little bit stressful. So we're trying to do as much as we can to help with the outcome of that. But yeah, I mean, and we have seen it sometimes where it can take months, to see a big difference. Like some patients where they start off with, not great embryos, but then, a couple months later, they actually have different reports and they're able to, go through with a transfer where they couldn't before. So, so I think it's important to look at all aspects of it and kind of just, get a big toolbox together of what you can do. And really, obviously, I love Dr. Palmerola's video earlier she had about when a patient tells her that they stop smoking.
But there's vaping instead.
Yeah, vaping and, well, actually from the partners, like we've had a lot of discussions with our patients that I find that a lot of the partners are smoking marijuana. And, sometimes maybe that doesn't get brought up or they, are just doing IUI maybe, or they're not really talking about that, but, or they're doing.
I always ask.
Yeah.
I always ask. I don't
medicinal marijuana is still like not great for sperm quality. So, so like, even though it's medicinal, it's not like helpful. And in that case, there's a lot of research about that for fertility issues. So, so everything we can do on the partner side as well, we try to work with them too and get them on board. Even though their sperm might look beautiful, like we talked about this in other lives, maybe the DNA fragmentation's off, or maybe, it doesn't hurt just to get healthier with your partner and give them that support, because the female is just doing so much of this process. It's like,
but it's only it's not equal in what we have to do compared to men, but it's truly half the picture. And men need to be on board with making themselves healthy and committing to healthy choices, so that the sperm that they provide, is the best that it can be, because certainly usually the female partner is doing that already. So
yeah, that's when we see the best results, honestly, is when the guy gets involved. And I'm sure that it's great to say like they have great sperm, but I think that there's other factors sometimes at play. And then you can also get to your retrieval, and who knows, like maybe that's a little different picture. There could be other issues going on. Who knows? So you want to make sure, like, I've never heard of someone saying, oh, I have way too many healthy sperm. Like, you can't, so it's impossible. So guys, do your part.
To piggyback on what you were saying, I assume this pre-submitted question: how often should you go throughout your pregnancy? I presume that means go to acupuncture, I think.
Yeah, because you're not going to IVF anymore.
No.
And it's funny because we have little meditations we use during the acupuncture treatment, and there's one for IVF. Obviously, we play that one a lot, just kind of like self-hypnosis, positive affirmations, relaxation. I love hypnosis. I'm always like a big believer in that, and I think it helps. And great to do during an acupuncture treatment where you have nothing to do but lay there, and relax. So there's one for pregnancy too. So we kind of flip from the IVF to the early pregnancy one. It's the same lady, same British ladies, super relaxing voice, but it kind of is a stage where I think you still need the positive affirmations, because you're still waiting for the ultrasound. You're still, nervous. Like, is this going to actually last? Like, are things going to be okay? Even though the numbers look okay, like, is everything all right? And you can't do ultrasounds every other day. So I think we still treat patients like throughout the first trimester. And then as needed after that, usually sometimes like once a month to come in for a prenatal massage or whatever that you feel like doing. And then towards the end, we try to work a little bit more on if they are going to do a delivery, instead of a C-section, if they're doing vaginal delivery, we try to do some pre-birth acupuncture points that help with just gradual cervical ripening, working a little bit on lower back pain if there's issues there. And again, like using, I think some meditations are helpful. There's even like hypnobirthing classes you can do at hospitals. We do those same meditations in the office with acupuncture. So it's kind of like a preparation part that's fun, you know, and then relaxing. Usually you want to get as much sleep as you can because it's a marathon. So you want to store up that energy for the big day. And then, and that's it. Like postpartum, we love seeing patients. It's just hard to see them because they're busy.
Occupied with keeping a human alive.
Yeah.
Which is what I'm approaching now.
Yeah. I mean, it's needed though, but sometimes it's very hard to get away. So like at least like once or twice, a little bit of postpartum treatment is good. So I think.
We had 2 additional questions submitted that Shirley sent me. Is it better to wait after the first 10 weeks of pregnancy to travel overseas? So my general rule is certainly if you've had, you know, a couple of ultrasounds by the time you're 10 weeks, especially if you're like if you're under our care, you will. And things are looking really positive and you've confirmed that you have an intrauterine pregnancy and all of that kind of stuff, you know, you can feel a little bit more at ease regarding travel. I would say the main thing about travel in pregnancy is that you're, in general in pregnancy, you're at much higher risk for a blood clot to develop. And so these long flights where you're immobilized and not moving and all of that kind of stuff is what's concerning. So you really need to make sure to like have some compression stockings on and maybe be taking a baby aspirin. A lot of our patients are taking a baby aspirin and making sure that you're getting up and moving every, you know, couple of hours to get blood flow going. And then, you know, so I think generally if you're able to achieve that, that's sort of the safest way to go about it.
Yeah, several years ago, we had a patient who was a NICU nurse and she was pregnant with twins. And so she actually said, well, let me take a trip to the West Coast because everything looks great. And, you know, she actually went into premature labor and she was away from her doctor, you know, like away from her hospital. She had to actually have them in 2 different hospitals. So they were separated. And she had to stay there because she couldn't leave, you know,
right.
So you're stuck there. Like if something happens, so obviously I know that that's not like the norm, but I think of that story a lot when I go like, yeah, I'm just going to take a trip somewhere. I'm like, wait, well, if something happens then you might not be able to leave for a while, you know? So
exactly. That also needs to be taken into consideration for sure.
Yeah.
If that's something that completely freaks you out, it might not be a good choice for you to.
Especially if you're going to another country, you know, just be careful of that.
Yeah, if you don't speak the language, there can be, you know, if you have a problem, you know, there's all those things to consider.
Yes, but have fun.
Yeah, it's great. Yeah. No, that being said, I think it's, you know, a lot of people do it and are fine. You just need to be mindful that sometimes things happen.
Yes.
The same person is asking, after a pregnancy test is positive, when are you able to hear a heartbeat? So generally, and right at the end of 5 weeks, usually around, you know, 6.5 weeks is when you start to be able to visualize and hear the heartbeat. So about halfway to 10 weeks before you doing your travel overseas. And then, I almost knocked myself over. Hold on. Let's see. And then the questions, actually a lot of the pre-submitted questions were, someone asked, any recommendation for minimally invasive uterine fibroid removal or surgery is the best option? Well, minimally invasive, I'm not sure what you mean. There's minimally invasive surgery to remove fibroids. And So I'm not exactly sure what this question is asking, but I can certainly tell you that whether or not you make a decision to remove fibroids from a fertility perspective really depends on the size and the location of the fibroids. Certainly, if a fibroid is taking up the majority of the uterine cavity or in and of itself is very large, that might be something that you need to consider removing prior to getting pregnant, because it can, pose as a physical barrier to getting pregnant. And then the other important thing is that to remember is that fibroids are hormone sensitive, and very often they can grow during pregnancy. And if you're already starting out with a very large fibroid that can grow even more during pregnancy, that can increase the risk of complications in pregnancy and things like preterm labor. Sometimes the fibroid itself outgrows its blood supply and can sort of have like a necrosis, which can be very painful for patients. Deciding on surgery, again, needs to be sort of a joint conversation between you and a fertility specialist. And then, depending on if the fertility specialist does surgery or not, a lot of us are not doing, very large fibroid surgeries anymore. So you may be referred out to someone. So it just really depends on your history. It depends on the size and location of your fibroids.
Yes, makes sense. And I guess robotic surgery is what a lot of people are doing too.
Yeah,
that,
robotic surgery, it falls under minimally invasive, because you just have small incisions on the abdomen as opposed to like one larger incision normally, like at the bottom where a C-section would be. And there's pluses and minuses. Generally, minimally invasive surgery, either whether it's laparoscopy or using the robot, your surgery times are longer, right? Because you don't, because you have a smaller space to work in, and it's not a direct hands-on approach. But often, even and it depends on the patient. Sometimes a longer surgery time is detrimental to a patient, but the recovery is usually easier with minimally invasive surgery. And so, it's always a pro and con situation. And again, it really has to do with not only characteristics of the patient, but the characteristics of the fibroids. Some fibroids are so large that they can't necessarily be done minimally invasively.
What the size limit is to get one of those out like that.
So it depends. It depends on the surgeon. It depends on the surgeon's comfort level. There are some that are willing to like break up a big, huge, like a 7-centimeter fibroid into little tiny pieces to get it out of a, 1 to 2 centimeter, 1 inch, incision. And some people won't do that, so it's, it depends.
Yeah.
Yeah.
Good to go somewhere that's all they do, right?
I agree. Yeah, you don't want someone that like just has a hobby of fibroid surgery. You want someone who does it like multiple times a week. For sure. Round canceled due to only 2 follicles. Stopped stem 4 days ago. Can I go back to yoga tomorrow? I don't see why not. As long as you feel okay. Seems reasonable.
Yeah.
Reasonable to me. Another question in that question thing was, is in vitro more expensive than IVF? And I think this person is confused because IVF is in vitro fertilization. So, yes and no. But yes, in vitro and in vitro fertilization are the same thing. So when you're asking about cost, that's what we're talking about. What's the data about acupuncture and fibroids? Is there anything related to that?
If they're smaller than like 2 centimeters, sometimes that can be helpful. But when you get over that, it's sometimes difficult. We've had some patients do really well just using herbal treatments with acupuncture and changing their diet, and with the really smaller ones. So they kind of just dissolve, and they, and their period starts changing, and they, it gets less heavy, less clotty. Yeah, I mean, it's difficult because there's so many factors that can influence it, and sometimes they have other things that are going on as well. But we view it kind of like, what is the estrogen metabolism like? Like if that patient's having issues where they're estrogen dominant, and they, have, like, we'll do a Dutch test, which is like a urine test that actually looks at, how they're utilizing hormones in their body, which pathways they're actually going down. And we see a lot of times with fibroids and endometriosis, kind of a similar pattern where it's detoxifying down like the 4-OH pathway or things like that are, it's kind of not really, it's kind of sticking around, and it could accumulate. And they tend to just kind of, in general, have an issue with that. So once we treat that with DIM, or we look at, ways to help, like cruciferous vegetables, things like that, we can kind of see that flip to a more protective pathway, and they're able to obviously, prevent the regrowth. Because I mean, it's really horrible to like go through the surgery and then have the fibroids grow back again. It's very frustrating for them, and as you've seen it too, and with endometriosis as well. Like I just saw one patient, she had seven laparoscopies for endometriosis. Yeah, and she's trying to get pregnant, so this is really difficult because that's like a lot of scar tissue sometimes, or trauma that you're going through. Like hopefully no scar tissue, but sometimes it can happen. So we look at, why are you, like, what's causing this, and kind of our view is like, maybe we can help the body, process these hormones in different ways, and nobody knows the reason for this, but we can see it kind of when we look at the this particular test that looks at that. It's pretty cool. It actually looks at, all hormone pathways, and you can kind of geek out on, where everything is, but also how they're metabolizing their progesterone, their testosterone. It's really nice with PCOS because you can see their DHEA levels, and how that's being processed. And then look at even down to neurotransmitters. So if somebody's on antidepressants, they're got hormonal imbalances, like what is going on? Are they depressed because of hormonal imbalances, or are they having hormonal imbalances and also depression at the same time? So so I do work with some OBGYNs that actually look at that test, and they think it's helpful for them too when someone's on like hormone replacement therapy. They can see if that's working well, so and then you have the blood work, so you can kind of look at both and see. We just had a patient where it actually tests your cortisol as well, so you can look at 5 cortisol responses throughout a 24-hour period. And one patient was like, I felt horrible, like she just could not get out of bed. We got it back where the cortisol was literally 0. I mean, there was just like none being made. And so we're like, go to an endocrinologist. Maybe there's something really wrong here, but maybe that's why you're not feeling good.
He's like,
you're just really, extremely tired, and something's going on. You're in your 40s, you should be making cortisol. So,
yeah.
But it all kind of ties in. So yeah, that's called the Dutch test. I believe like it's been out for about 10 years, but still it's kind of like, some practices know about it, some don't. I guess it's still considered integrative medicine. Yeah. But I think, yeah, it's 20 pages of hormones. It's really fun. So especially like biochemistry, it's really nice to see.
Sounds daunting to me.
yeah, it's good. We've actually had some patients that they've had breast cancer, and their oncologist wants to see it because they want to see if their estrogen levels are still kind of good with their treatment, or are they producing levels that are not going down the right pathways, that sort of thing. So but yeah, that's a neat way to look at it if you have fibroids, to figure it out, kind of like what's going on inside your body, in addition to the blood work that you're having with your OB or your RE. And then hopefully those fibroids will, we've had some patients where they just never came back, which is so great. Like they never have to deal with them again. They're not growing back, and that's nice. So yeah, so that's important. And one thing is to experience the symptoms of it. And some people have, no symptoms, but some people have horrible periods, as you see, like they just bleed like for weeks and weeks, and how can you try to get pregnant too when you're constantly bleeding? It's not fun.
A lot of things that provide, that are just such barriers to getting pregnant, that I think a lot of women just live with and don't necessarily speak up about.
Yeah.
So I think it's an important lesson for, if you feel like there's something wrong and you're bleeding for most days of the month, that's not a normal thing.
Yeah.
You need to need to be seen, or if you're having such debilitating menstrual cycles that you can't work for a couple days, or you can't go out, or anything like that. Like, again, these are not normal things, and they're not things that you have to fight alone or deal with alone. Any, like an OBGYN or someone like myself can certainly assist you with guys with those kind of problems, and there's just no need to suffer.
And then definitely look at the iron. Sometimes they're very anemic, and that's a big issue. Don't let it get to that point.
No, for sure. Well, we were just beacons of efficiency answering questions. Look at that.
We did. We got through it all, and we're early. And I know that, I definitely commend you for doing this, because I know that at this point you're probably like, okay, you get to the point during the third trimester where you're tired.
Yeah. I'm not the most comfortable, but you know what? All in, I'm trying to be grateful for a healthy pregnancy and all that kind of stuff. And yeah, it gets tougher towards the end, but trying to deal with it.
Well, congrats. Please hopefully post some pictures and keep us all updated. We're all really wishing you the best. Congratulations. And yeah, thank everybody for submitting their questions tonight. It was a rainy Q&A kind of day here. I was like, yeah, it was good to do little questions and answers. It was storming here. I don't know about where you are, but it was really...
up in Jupiter, but it only started at I don't know, 5:30 or 6, but it was pretty intense for a little period of time. So with thunder, which
I was just hoping, okay, hopefully we have internet,
Yeah.
But it was fine here.
Yeah.
So
that's good. Anyway, well, and I guess as long as, if we don't have any other questions to answer, and I don't see anything else submitted, let me just check the question thing one more time. I think we addressed all of those questions. So I guess at this point, we'll just let you know that certainly you can, Dr. Duro does these live Q&A sessions with a bunch of our doctors at IVFMD, multiple times during the month. So definitely, if you have questions, it's a great forum to get them answered. You can certainly follow me at Jessica Bauer _fertility doc on Instagram. So and you can always DM me for specific questions or anything like that. And then Dr. Duro can share her contact information as well.
Yeah, we're at LFL Complete Wellness if you want to follow us on Instagram, and we post updates, some interesting little tidbits, and definitely we host lives as well. Any questions we get, we're happy to answer them. And we also do phone consultations. I'm sure as you do too. If you have questions and you're not in the South Florida area, we're still happy to try to help with whatever we can. And we'll look forward to the next one. So we'll see you soon whenever we can see you again, Dr. Bauer.
Yeah,
your last one with us.
Might be after the summer.
Yes.
So we'll see.
So
take a little hiatus. So I'll definitely miss you guys and come back, hopefully recharged and ready to answer all your questions.
Yes. Yay. Awesome. Well, have a great night. Thank you so much for joining everyone. And thank you, Dr. Bauer. Appreciate it.
Absolutely. Thanks, guys. And have a safe night and a good rest of the week.
Bye, everyone.
Hey, take care.